So today we're meeting with Rick Collins, Esquire, a famous attorney, and he was actually my attorney in my case. And we're going to be talking about performance-enhancing drugs, PEDs, and the history of PEDs, how they became illegal, and how over time things have evolved into the state of affairs that we are in today, which has become the Wild Wild West.
Holy land, the blood is rising from the river to the sea. Holy land, the cross is burning on the hills of Calvary. You wanted more.
I'm here today with Rick Collins, Esquire, a famous attorney. He was actually my attorney on my case back in 2007. And we're going to talk a little bit about the history of PEDs and basically how they became a Schedule III controlled substance. And Rick's going to give his expertise. And then we're going to go more into the status of how things have evolved and where they're going.
Sounds good, Larry. Thank you for having me on. Good to see you.
I appreciate it. So as we were talking, Rick was my attorney when I caught my case in Operation Raw Deal.
Back in the day, seems like ages ago. What was that, 2007 or so?
2007.
Yeah.
And I actually called Rick before I even got in trouble. And I said, I think I've got problems. And he said, well, you don't have a case, so I can't do anything. I said, well, how about I just give you this $10,000 and just hold on to it because I think it's going to come.
Yeah. Well, look, Operation Raw Deal was one of a number of operations federally that they went after steroids, and most of them after the 1990 law passed, and so DEA was involved, and these became federal cases.
So as we were talking, when I was coming up back in the 80s, when I was a teenager in the gym, anabolics I guess they were classified, but they weren't Schedule III or anything, and we didn't even think of them as drugs.
They back at that time they were like penicillin or any other pharmaceutical drug that needed a prescription, and so there were no more red tape or regulatory requirements for them than there would be for any other pharmaceutical. It was only in the aftermath of the sports doping scandal of 1988, which was the Ben Johnson Seoul Olympics scandal, when Ben Johnson, for those who don't remember, he was a Canadian sprinter, won the gold medal in the 100 meters, and then tested positive for Winstrol. And he beat the Canadian, he was a Canadian, he beat the American Carl Lewis. So you had a situation where suddenly the sports world turned upside down, the American media sports media went crazy. And so in the aftermath of that scandal in 1988, Congress held a bunch of hearings, and in 1990 passed a law that changed the scheduling of anabolic steroids from these prescription drug status that it was into a controlled substance status by adding it to the same criminal infrastructure that cocaine and heroin and methamphetamine and traditional narcotics and drugs of abuse find themselves in, right? And so suddenly people in the gyms who were previously thinking of these things as maybe super vitamins or just part of a training regimen, and I don't think anybody was really thinking of themselves as a federal drug criminal. But that's what happened, and that's what happened when Congress took action. And not many people remember, but in those hearings, various agencies sent witnesses to testify to Congress about what should be done about this problem of steroids in sports, right? Cheating in sports with the use of chemical enhancement. And the majority of witnesses testified that the controlled substance status solution didn't make sense, that wasn't the way to go. And that included the DEA, the AMA, American Medical Association, the National Institute on Drug Abuse, and even the FDA all sent witnesses to testify to Congress to tell Congress, do not make anabolic steroids into this same act with other traditional narcotics and drugs of abuse. But Congress had its mind made up to try to get steroids out of sports. A number of Congress people and Congress and Senate representatives were pushing for it. One of them was Joe Biden, who was one of the loud voices to take steroids and schedule them. And so that's what happened, and the law went into effect in February of 1991, and that really changed a lot of things for people who were using steroids either medically or non-medically.
So I wanted to step back a little bit and talk about when I was coming up. I just happened to be growing up in L.A., and at that time, Joe Weider had his Weider Empire with Muscle and Fitness magazine, and then later Flex, and all the bodybuilders from all around the world were under contract with Joe Weider, at least most of them were, and so they were all living in L.A., training in the same gyms, World Gym, Gold's Gym, and another gym called Don Peters Gym. And there were two doctors there, one named Walzak and another named Jaycott. And they were the, quote, steroid doctors.
Right.
And pretty much as far as I know, all the pros, maybe even amateurs as well, were going to these doctors and getting their prescriptions and getting their blood work done. And Walzak even did a thing where he was like filtering people's blood, like through dialysis or something.
Mm-hmm. Okay.
But and basically they were monitoring their health.
Right.
And so we didn't think of it as even anything bad. You'd go to the doctor, he'd write you a prescription, you'd do your blood work, and that's what everybody did.
Right.
And the dosages weren't crazy high either, because obviously the doctor was writing the prescription, and you're getting what you got.
Right.
Plus, we didn't we didn't even consider crazy dosages back then. It wasn't a thing.
Right.
And so because of that, the stigma wasn't quite there yet. But it was a very niche community. Like, only the people that were competing and really in that circle really even knew. It wasn't so much in the public. I don't think the public even knew so much about it.
Right. I think what changed that was the use in other sports, right? I mean, bodybuilding has always been a little fringe subculture. I grew up in that same fringe subculture that you did. But it was really when you started having scandals. There was talk about in the mid to late 80s, talk about steroids in the NFL, talk about steroids in high school sports, and then of course the Ben Johnson scandal, and that really catapulted it to more of a public consciousness, right? The idea of cheating in sports, the idea of an unlevel playing field, and so the anti-doping movement was really very powerful in demonizing the use of testosterone or other anabolic steroids to cheat in sports. And I do think that while there were witnesses who testified to Congress about negative health effects, and certainly every drug has negative effects, and I don't think anybody would say that there's absolute safety with any drug or substance at all, right? I mean, you take an aspirin, your headache goes away. You take a bottle of aspirin, you go away. People have died from drinking too much water. So the reality is that every drug has side effects, and steroids are included in that for sure. And very often the dose is the devil, right? The difference between a medicine and a poison traditionally is the dose. But obviously, when Congress took action against steroids, the effect was to sort of remove a lot of the interest by the medical and pharmaceutical community from being involved with them, right? Suddenly they're in the same category with these traditional drugs of abuse, Now there's all this red tape once the law went into effect in 1991. And so what happened was that prior to that, most of the products were diverted U.S. FDA-approved medicines, right? The drugs were being backdoored out of legitimate pharmaceutical drug chain, either through friendly doctors like you've described, and Jekka actually went to prison. In the book I wrote on steroids, Legal Muscle, from way back over 20 years ago, he was one of the cases that I cited in the book. But once the law went into effect, you had this really discontinuation of a lot of the interest of big pharma into anabolic steroids and testosterone, and you had doctors who suddenly really didn't want to really be involved with these drugs of abuse, and pharmacies no longer really interested in carrying it. And so basic law of economics is where there's demand, there's going to be supply, right? And so, and you remember this pattern, right? So when Congress took action against steroids, the U.S. FDA-approved, controlled, GMP compliant, good manufacturing compliant products went bye-bye, and yet the demand remained. And so there was a period of time where bodybuilders and other recreational steroid users were taking cattle implants to get the steroid out of the cattle implant. So you had these dissolving of cattle implants,
the trenbolone
out of them. You had labs in Mexico beginning to ramp up their production of anabolic steroid products, often mislabeled as veterinary products. So you had pictures of various types of domestic animals on the bottles and boxes of the products. Now, were they made for animals? Of course not. They were made for American steroid users because the volume would have exceeded enough to juice up every dog, cat, horse, goat, and sheep in America, right? So they were made for folks, but there were lesser regulatory obstacles to getting them into the U.S. by labeling them as veterinary products. So you had a lot of that going on. And that evolved over time. I found that, and I've been doing, just by way of background, I've probably represented more users, distributors, underground labs, importers of anabolic steroids and other performance-enhancing substances, including growth hormone and SARMs and various types of peptides and prohormones than any other lawyer on the planet for a long, long time. And I'm blessed to do what I do. I love what I do. I'm very grateful to be an attorney with, as they say, a very particular set of skills that enables me to help people who benefit from my knowledge and expertise, as well as my skills as a courtroom lawyer, having been a prosecutor in the past and a criminal defense lawyer. So I've got all the necessary ingredients for a recipe of success in defending these cases. But what I found was in that almost a decade later, when in 2001 you had the tragedy of 9/11, in the aftermath of that, you had U.S. Customs and border officials scrutinizing the imported packages that come in at international ports, airports around the country. And so catching finished product was much more likely. So those vials and pills that were coming through were much more likely to get intercepted, and you had situations where if it was a large amount, and sometimes even if it was a small amount, the officials would do what's called a controlled delivery of the product, where somebody who ordered some steroids from, let's say they ordered a tub of Anabol, the methandrostenolone, equivalent of Dianabol from Thailand, those little pink pentagons from back in the day. So 1,000 of those in a tub comes through, let's say at a particular airport, and the officials are, aren't that busy, and FDA is given the package, and they decide that they're going to deliver it. They deliver it to the designated recipient with a anticipatory search warrant, which enables them to ransack the dude's house and take all of the evidence that might link him to that package, and he gets arrested and charged with it. So you started seeing that happening more, and so the market changed, right? As long as there's demand, there's going to be supply, into ultimately what it is now, as you know, which is the majority of the steroids in the U.S. are not FDA approved or finished products from overseas. They are the result of raw powder being imported into the U.S. to a person who is essentially a cook, who then in an underground lab, which is basically somebody's kitchen, makes the steroid liquids, or in some cases pills, and then sells them on social media for folks to use. And when we talk about what the effects of that law were, well, it certainly wasn't to make it any safer from a harm reduction standpoint. And harm reduction, I think, is a good policy when you deal with a behavior that, let's say, the government doesn't want to happen, because maybe some people will be hurt by it. The way to approach it is to do harm reduction at the same time that you're trying to curtail that behavior. This didn't reduce the harms because you brought physicians out of the equation, you brought pharmaceutical companies out of the equation, and so now you've got products that are made in somebody's house from ingredients that are imported from a communist country that are being sold to anybody with a social media account of any age, and then used based on the instructions not of a physician but of whatever information is gleaned off the internet.
Mm-hmm. Yeah, and so basically, they took when these doctors got arrested, none of the other doctors want to be involved anymore.
Of course not.
So now you have people that don't get their blood work done anymore. They're not even getting checkups. I'm fortunate. I work with an endocrinologist. I have a gastroenterologist and a primary care physician. So I get all my stuff checked, but most people don't.
Yeah, and certainly that's not a good thing. Everything can have side effects. Steroids can affect blood pressure, for example, and that's something that if you don't go regularly to the physician and you don't have an at-home blood pressure monitor, you have no idea whether you're hypertensive, right?
Right.
And there can be unfavorable cholesterol changes, lipid changes, lowering of good cholesterol, raising of bad cholesterol. I think some progressive doctors now say that, the reliance on cholesterol as the be-all and end-all of health was overdone for a period of time, and that may well be true, but it's still a factor to look at, right? And so you could also have, some level of increase in red blood cell content. So, you want to be monitored, right? And if you're using orals, there could be some unfavorable hepatic liver issues. Mm-hmm. So, like I said before, the devil is in the dose very often, and we could certainly talk about how kind of the alarmist approach to steroid use may have, to some extent, exaggerated the risks, and that's never a good thing, because some people, when they figure out that you're exaggerating or overstating the risks, go the other way and say, well, then there must be no risks at all, which is not a good thing. Mm-hmm. So I think that approach was a failed approach by the media and by the sports medicine community. If you remember, and you'll remember this, there was a time when the sports medicine community's position was that steroids do not work, that they do not enhance performance, that they, it's all, smoke and mirrors. And it didn't take long for the steroid using community to recognize that that was BS. And, if you're lying about that, then you might be lying about there being any negative side effects to this. Very horrifically bad choice for the medical community at that time. Probably just thinking, well, if we just tell them they don't work, then people will stop taking them. Not really recognizing that the effects are so obvious that nobody's going to, quickly enough, everybody's going to know you're not being honest.
Yeah, and again, we get back to the situation that we're in now, where most people don't get checked because there are certain doctors out there that are willing to do it, but by and large, you can't go to your regular physician or your local endocrinologist and say, I'm taking this stuff and I want you to monitor my health, do my blood work regularly.
Yeah,
most won't do it.
The medical community is pretty far behind typically. If the average endocrinologist or urologist is not really up to speed on testosterone, there are still those who believe testosterone will cause prostate cancer. You still have those who believe that a little bit of testosterone is going to be a cardiac risk for people. The evidence actually shows low testosterone is the cardiac risk for folks. So I don't know, it takes a while, I guess, for mainstream medicine to catch up on this issue. There are physicians who are knowledgeable, and I know some of them. They typically gravitate away from the traditional medicine kind of paradigm and go into concierge medicine, where they get more involved in wellness rather than sickness. Western medicine is just a sickness-oriented concept where, if you break your arm, go to the doctor and they'll fix it. But if you go to the doctor and say, I'm well and I feel great and I want to continue feeling great, or I want to feel even better, there's typically no answer that they can give that makes any sense for that.
I have actually had to train my doctors. And what I mean by that is, initially when I started working with them, I'd tell them, I want certain blood work done. And they'd be like, well, why do you need all this? So I just went and ordered my own labs, and then I would bring my labs to them. And then they started ordering my labs.
Right.
But I'm a little bit more assertive, and I have more experience than the average person going in there talking to them. So they realize, after I walk in there with a handful of studies and lab work, that I have something to talk about.
Yeah, you're an informed patient, and suddenly they can't just steamroll over you. Yeah, you and I have spoken before about the medical communities. Even today, maybe it's gotten a lot better, but I remember when I was competing in bodybuilding back in the day, young man, pretty muscular, going to my doctor, internist for the annual physical, and he would take a look at me and say, what are you doing? Why are you lifting weights? This is a terrible thing to do. It's a terrible idea. You're going to ruin your joints. You're going to ruin your muscles. Just run. All you need to do is run. And he's standing there, weighing all of 120 pounds, with spindly arms and a little pot belly. Okay, you run and great. As time has gone on, I knew even then that he didn't know anything about physical culture or health or muscularity. But obviously the science has evolved over time, and we now know that the lifting weights and resistance training is even more important for longevity and wellness as you age than aerobic exercise. They've put geriatric women in their 80s on resistance training regimens and found that it's the only thing that actually reverses osteopenia and osteoporosis. You actually increase the bone density, recalcify the bones. Just an amazing thing when you think that the spiral that old people, geriatric patients usually have is they fall, they break a hip, and from that point they just go downhill. And I used to work in a nursing home. When I was in college, I had 3 jobs, Larry. I was a nursing home orderly, I was a personal trainer, and I was a bouncer, throwing people out of bars on the South Shore of Long Island for a number of years, working my way through school. And I learned a lot from all 3 jobs. But I learned a lot from just being a nursing home orderly. You learn a lot about humility, but you also learn a lot about not wanting to ever be in a physical state where you could not take care of yourself, where you needed an attendant to do the sorts of everyday bodily function stuff that we take for granted. And so anything that extends health span, longevity, and the not just living longer, but living well longer.
Quality of life
is the key. Quality of life, and certainly resistance training, good diet. And I say good diet even as we're now, I think, at 70% obese and overweight in this country. Making good choices in what we eat, and being smart about kind of fighting Father Time or fighting Mother Nature.
I think it's important that people understand the progression of how steroids went from being like a prescribed medicine into a Schedule III substance, and what actually happened during the Balco scandal and when they had those hearings. And one thing you recall is the FDA, I believe it was, even testified that they don't meet the criteria of a Schedule III controlled substance. They're not accumulative, they're not addictive, not in the real world sense of narcotics. But the poster child for that, you probably remember, was this kid named Taylor Hooton, who committed suicide. And according to his father, he committed suicide because he took steroids for playing baseball, and when he went off the steroids, he got depressed and committed suicide. They didn't talk about that he was on all kinds of what do they call them? Antidepressants.
Yeah, he was on Lexapro. That was it's. Look, if anybody wants to see a good movie about how steroids have been seen in American culture and politics and law and medicine, I was privileged to have been part of the team that worked as to put together the movie by a great director, Chris Bell, called Bigger, Faster, Stronger, which was released in 2008. And the Taylor Hooton case was addressed there. Actually, the director met with Taylor Hooton's father to discuss his death. And it's a very moving scene where they talk about it. But yeah, the Taylor Hooton case was one that got the attention of Congress. Again, that was around 2005 or 6 or 7, somewhere in that range.
2005.
So it was after steroids had been made a controlled substance, but it was during the time that Congress had a renewed interest, and there were more hearings that were held. And you remember, you mentioned the Balco case. So for those who were too young to remember it, in around 2002 or 2003, there was a sports and athletic outfit in Northern California called the Bay Area Laboratory Cooperative, run by a guy who had once been the bassist for Tower of Power, the band. And it was catering to athletes to try to increase and improve their performance. and ultimately there was an operation, a government operation, to try to figure out whether they were actually using banned drugs to juice up the athletes. And there was a criminal prosecution that came out of it. I actually represented the chemist who created one of the drugs that was part of the scandal. So there was a big sports scandal about the Balco case in that time. And the Congress, when they see these sorts of things, that led to hearings. Congress was also looking at that time, you may remember, there was a category of sports nutrition products called prohormones that had become quite a big seller in sports nutrition. And these were anabolic steroid or anabolic steroid-like products that were steroidal but were loopholed out of the existing law that regulated anabolic steroids as controlled substances. And so they were being sold over the counter in health food stores, mom and pop health food stores across the country. There was actually an operation into an online website in Boise, Idaho, where they made a whole list of different pro-hormone makers and marketers, and they went after a bunch of those companies. And I represented a number of those companies in the aftermath of that search warrant. So yeah, Congress had more interest, and the 1990 law that we talked about was revised twice. In 2004, Congress tried again. Basically, well, we didn't go far enough in that 1990 law because we allowed all these other compounds to be loopholed out of it. So now we're going to kind of address this pro-hormone problem, and then realized 10 years later, well, they didn't do it again. They, another swing and a miss. So in 2014, they went at it yet again, and redid the law. And at that point, the market for pro-hormones pretty much was decimated. But it took three shots for Congress to really address this issue. And Congress was not the only one who kind of cracked down on steroids. The United States Sentencing Commission had its own hearings into whether the punishments for steroids were sufficient. And those took place in like 2005 or 6. And I was called as a witness in Washington at those hearings. And they ultimately decided to increase the punishments for steroids. Prior to that, from a United States sentencing guideline perspective, one pill, 50 pills was 50 pills was 1 unit of an anabolic steroid, and a 10 cc vial, so your standard 10 ml vial, was a unit of steroids. In 2007, that calculation was changed so that instead of 50 pills being a unit, it was 1 pill was now a unit. And instead of a full vial, 10 cc vial, it was now half of a cc was now a unit. So that was 20 units. So a vial became 20 units instead of. So you had this effectively a 20-fold or 50-fold increase in the potential punishment based on units for federal cases. And that went into effect, and that resulted in much higher potential punishments for people who are trafficking certainly significant volumes of anabolic steroids.
I think it's important for people to understand when you talk about pro-hormones, the reason those came about is because they did ban the original anabolics. And there is a difference. The original anabolics were studied by big laboratories, and there was lots of clinical testing done, and certain ones were used and certain ones were discarded based on, performance and health, things like that. And so the compounds that did come out from the original pharmaceutical products were actually what I consider clean, as far as less side effects, more studies done, more known about. And when you took that away, now you have the pro-hormones, which I actually consider dirty steroids. And what I mean by dirty steroids, these are substances that there's been very few or no studies on.
Right.
And the actual ingredients in there are suspect because it's not done by, it wasn't done by a big pharmaceutical company or a lab. It was done by basically a vitamin company or whoever.
Yeah. So when we made that list earlier, that's a great point, Larry, because when we made the list earlier of sort of the things that happened as a result of the criminalization of steroids through the Anabolic Steroid Control Act of 1990, and we look at the things that happened that were contrary to the concept of harm reduction. In other words, harm escalation, making things more dangerous, making things less safe. That we can add to that list, right? Because you went from, not only FDA approved medicines that then went to Mexican veterinary steroids or other stuff, but you actually had these creative chemists looking at what was illegal based on the existing language of the law and saying, well, let's come up with, let's blow off and blow the dust off this ancient steroid that was hardly studied at all, or in some cases, let's hybridize some new steroid that's never been studied at all, and let's sell this to people to use. And so that's what some of the prohormones were, that were just loopholed steroids that had never been sufficiently studied. So not only were they unstudied, but in some, to the extent that prohormones were made under suspect conditions, you had lack of good manufacturing practices and a substance itself that we really don't know how it might affect you.
Well, I know myself, I had tried them at one point, and they felt like dirty steroids. I mean, they were more estrogenic, just more side effects than you would get from your typical pharmaceutical Anavar or Primobolan or something like this.
Yeah.
So they were dirty. I remember trying it and instantly feeling not good, not well.
Right. Well, certainly when you look at steroid side effects, oral steroids have a number of side effects that injectable steroids typically don't, right? And
right.
The layperson thinks, well, somebody who knows nothing about steroids might say, well, I'm better off taking an oral steroid because I'm used to taking vitamins. It's just like taking a vitamin, rather than taking something that I'm going to be injecting into myself through intramuscular injection. But the reality is, when you take something like a steroid orally, it's got to survive the first pass through the liver, right? Otherwise, it's not useful. You got to get it into the bloodstream. So it's got to survive that first pass. And in order to do that, it's got to be configured in a certain way. We call it alkylation or methylation. Essentially, it's a tweaking of the molecule at a particular carbon atom so that it survives that first pass through the liver. But when that happens, in order to do that, well, the liver tries to break it down, right? The liver is trying. So the more orals you take, the more the liver is working, trying to break this down. And so large amounts of orals will begin to stress the liver, and ultimately can seriously hurt the liver. So that's why they're called hepatotoxic. But an injected steroid that goes directly into the muscle and then through the body, gets right into the bloodstream, and so you don't have that same issue.
And just to be clear, for people who don't understand this, Tylenol, which is sold over the counter, is the most liver toxic thing that you can take.
Yes. Yeah. And so obviously, if you have a terrible headache or you need Tylenol, in limited short periods of time, you're not going to have a huge amount of stress on the liver. But if you start taking Tylenol regularly, or for a long, for a period of time, days into weeks, yeah, your liver is going to show tremendous stress and potentially, hepatotoxic damage.
So we've gone through kind of the evolution of how things have gotten to the point of where they are today. And now we're in a situation where I feel like it's the wild, wild west again, because everything is being imported from China, all the raws. And by the way, just so people understand this, the raws that are imported from China that are in the UGL are the same raws that are in the prescription drugs that you're getting at your Walmart or your CVS. All of this stuff is made in China. None of it's made here in the United States. So the raw materials are all coming from China. I know this for a fact. I know this because I was in the business of doing this and buying the raws, and I also had connections with pharmaceutical wholesale companies in the United States who sold their raw materials to, Walmart, CVS, but they also got their raws from China.
Right.
So all the raw ingredients are coming from overseas.
That's even true of many of the vitamins, virtually all the vitamins that we take. Those raw ingredients are all coming from China. That's just the reality of some of the clothes we wear as well. So,
right.
And many of the parts of our electronics.
Well, it's just cheaper to manufacture there, and,
Right.
They have the infrastructure for doing it, and
Right.
we don't. So that's a reality.
It is.
Also, this is something interesting that happened to me by accident. So there's a product called Flomax, and it's used for prostate enlargement. And one side effect of androgens can be enlarged prostate, which makes it difficult to urinate. So Flomax was something that I consider like a health, something to prevent that from happening. Sort of like, how would I say this? Something to prevent the side effects of the high androgens. Anyways, at the time when I had my lab, I was, buying Flomax out of the pharmacy, but I decided, I can make my own. So I bought the raw ingredients from China, and I made little tablets, and I know they were dosed accurately because I knew how to do it. And I had a lab in Utah at the time, and I would send a sample of every batch to the lab to test it because I wanted to be sure that, it had the right dosage and it was,
Right.
purity and all this. So I sent them a sample of what I call prostatate. I just named it that. But the chemical is 10-mucilin HCl. So I sent it to him, and a few weeks later, I hadn't gotten a result back. And usually I got my results like within a week or two. And I called them and I said, hey, what happened with this product? And they said, well, we don't have a control to test against. So I went to the pharmacy and I bought Flomax straight out of the pharmacy. And I sent it that. And they called me back and said, well, we're having a hard time with this because compared to yours, this product that you sent us was only trace amounts of the actual raw material. So they actually contacted Boehringer, who was the manufacturer of Flomax, and asked them for the raw materials so they could test it, a sample of raw materials. Boehringer told them they were out of raw material. So meanwhile, they had this stuff on commercials, selling it in pharmacies, but they're out of raw material, and whatever they were selling in pharmacies didn't even have the prescription drug that was in it.
Right.
And this stuff is also used as for prostate cancer treatment.
Yeah. And I'm sure most of your viewers are familiar with it, but for those who aren't, steroids work because these androgens that you take in exogenously, in other words, from outside the body, then come into the body and they attach to certain androgen receptor sites. And so those receptor sites are, the ones you want them to attach to are in the muscles, right, in the skeletal muscles. So if the androgen receptor meets the androgen, well, now you're going to get the protein synthesis and the building of the muscle in the skeletal muscle. But there are androgen receptor sites in other places in your body, and one of them is, as Larry says, in the prostate. So you don't want to stimulate your prostate. Nobody wants a prostate the size of a cantaloupe, right? So you want to try to, if there's a way of not having it stimulate that. There are androgen receptors in the scalp. So when we look at speeding up the acceleration of male pattern baldness in somebody who is using steroids, well, that's because there's androgen receptors in the scalp. There's in the skin as well. So you've got potential acne or other issues that can come from the use of steroids because the androgens are getting into those androgen receptor sites. And there are, as you and I both know, there are many drugs that steroid users will take to specifically address some of these specific problems, whether it's skin problems or prostate problems or scalp problems or other places where the receptors may pick up those androgens. And that's why very often people who use anabolic steroids are not just using one steroid or two steroids. They're using kind of a polypharmacy approach of a number of different products to address or to either mitigate or the effects you don't want, or to improve the effects that you do want to work synergistically. So a lot of people will use growth hormone, for example, in addition to testosterone or an anabolic steroid. And those who are more serious may use insulin or other things. But it's not uncommon for me as a lawyer dealing with criminal cases involving anabolic steroids. If there's a search warrant executed, very often it has a recovery of a whole lot of different drugs, different, you name it. There's steroids, there's growth hormone, sometimes insulin, tamoxifen, clomiphene, anastrozole, all of these different, it's a cornucopia of different types of products. And sometimes it's in prodigious amounts because people who use steroids use them in cycles, obviously, and nobody wants to get caught in the middle of a cycle to be short of the planned cycle. So most people who use steroids will acquire all the steroids they need for a whole cycle or sometimes multiple cycles. So it's not uncommon for a personal user to be in possession of what to the untrained law enforcement eye would appear to be a warehouse filled with steroids, because there's just so many different things and different amounts and different vials. And if they're using ampules, there's going to be a whole lot of them. And so very often one of the issues that I encounter in my cases where I'm defending people in steroid cases is the issue where the person is initially charged as a dealer based solely on the volume. In other words, we found all these steroids and this is too much for a person to be using, him or herself. So it's got to be, this person's a dealer. And I remember a few years ago having a guy who, imported, let's say, the tub of 1,000 Anabol, and they recover that. And in the untrained eye of law enforcement at that time, they were thinking of it like 1,000 tabs of ecstasy. So now this guy's going to go to the club and he's going to kill all the children. So they were going after him as this big time dealer, when in reality that was the minimum amount that he could have purchased from that Thai source, was the tub of 1,000. And so I come in, and my role in those is to sort of put the kibosh on the misinformation and to educate sometimes both the prosecutor in the case, the court, the judge, and law enforcement to get a result that is not unjust or unfair, where nobody should ever be charged with something that they aren't doing.
I think it's also important for people who don't understand this, that are uneducated about this, to point out that, when you say there's so many different compounds involved, you're thinking like this is a drug addict taking, a million different things. But that's actually not really the truth. The truth of the matter is you're taking specific things that are synergistic, so you have to take less dosage, and you're also taking other compounds that are used to harm reduction to reduce side effects, like an anti-estrogen,
Sure.
for example. And so it's not that you're just wanting to take everything under the sun. Well, some people do that, but
Right.
someone who's educated about this, you might, rather than taking one drug and taking a whole lot of it, you might take 5 different things,
Right.
but the dosage is way lower and the side effects are way lower because that's why you're doing it that way.
Right, right. And for those who are interested in some of these issues, a few years ago, I think it was around 2006, I was involved with a group of researchers. There were 4 of us, and we did an internet survey of non-medical anabolic steroid users globally, including a lot here in the U.S. I think we had 2,000 steroid users who were using steroids non-medically in the U.S., and they did an extensive questionnaire which was anonymous, and so no reason to lie, and accepted protocol for surveys of this type for scientific review and publication. And we asked questions ranging from, why are you using them, and how much are you using, and what are you using, to questions about, well, who are you? How old are you? And when did you start using steroids? And why are you using steroids? And what do you do for a living? And so how educated are you? And we put all of that in, and you can find it online. You can Google A League of Their Own, JISSN, which was the Journal of the International Society of Sports Nutrition Journal. And so, and you can read it, and you can see who's using steroids and why are they using steroids and how much. Now, again, it's somewhat dated perhaps in terms of the amounts, and maybe people use more today than they did then. But there have been similar surveys, maybe not as large, but similar ones conducted by other researchers since then, and the results have been pretty much the same. So, for example, 80% of the people who are using steroids for non-medical purposes are using it for purely cosmetic purposes. In other words, to look better when they take their shirt off. The vast majority are not competitive athletes, not even competitive bodybuilders. There's just not that many competitive bodybuilders out there or competitive powerlifters to make that big of a difference. And so while it's maybe the pro bodybuilders or the elite bodybuilders or the track and field athletes or the cyclists who are in the news for the use of steroids or other performance-enhancing drugs, the reality is they are a tip of the iceberg. They are a small percentage of the overall population of people who are using steroids non-medically, who are, again, people who are using them for purely aesthetic purposes because they want to look good when they're on the beach in the summer. And maybe it's vanity, and maybe we as a society shouldn't encourage those things, but we do in so many other walks of life in this society. Vanity runs rampant. And so it is interesting that we've decided to criminalize a behavior that is largely motivated by people wanting to look better, when we don't criminalize lots of other things. We're a Botox and liposuction society. At this point, no one would ever think about cracking down on breast augmentation or other types of behaviors, which also have risks, certainly. And we've all read about watch the series Botched or any other show that depicts how things can go wrong with cosmetic surgery. I remember a few years ago there was a bodybuilder who actually went to Mexico to get calf implants because he just couldn't get his calves to grow, and went for a discount calf implant job, came back and got infected, and ultimately had to be amputated. He lost both legs at the knee because of infections in both legs. So cosmetic surgery, even the best cosmetic surgery with the best of surgeons, has its risks to it, but we don't We don't crack down on any of that.
So now we're in a situation where, because of the internet and global trade, I think more people are aware of anabolics, and the idea that they don't work, obviously, people know that that's not true, even the general public.
That horse left the barn.
Yeah. And so they're more prevalent, they're more accessible than ever. They're easier to get because people literally just go online. I see that people are advertising it on Facebook Marketplace, Craigslist, just everywhere.
Instagram,
Yeah,
sure.
exactly. So now you have a situation where anybody can get these things from wherever they're coming from, all over the world. And doctors are largely not involved anymore, for the most part. I mean, there's HRT clinics,
Yeah.
but they play a small role in, HRT because they're limited in what they can do. So where do you go from here?
Right.
What,
Right.
You're not going to stop people from taking them because
Right.
people know they work, and
That's
they can.
the demand, and so there's always going to be supply, right? Basic
Right.
economics. So, what do? We've decided, I think, in a bigger way, that the war on drugs has been a failure in many respects, and I think there's even law enforcement personnel are beginning to come to the conclusion that harm reduction needs to be integrated into the equation. As a criminal defense lawyer, back when I was a prosecutor, the only way of dealing with a drug possession charge was to threaten jail or put somebody in jail. Those days are gone now, right? So we now have drug diversion courts in virtually every place in the U.S. so that people who are using heroin or meth are often we try to divert them to harm reduction programs to try to get them off the drugs and try to get them to deal with their addiction. And so I think we're moving in the right direction on many drugs. The state of a few states now, I think, have begun to change their laws, and Oregon legalized the possession of personal use, possession of all drugs, or decriminalized it anyway. And so we've got that kind of movement when it comes to hard drugs and narcotics. I don't think anybody's really thinking about those, interestingly, for steroid users. I think that the mentality is really that drug addicts of narcotics are more sympathetic than steroid users. And I think part of that is just the stigma from the sports cheating aspect, the ethical aspect. That it's very hard to disconnect that stigma from steroid users, even if they're not competing in sports, even if they're just doing it for the same purposes that somebody might get Botox or liposuction. That disconnect is very hard to do. Are there potential changes down the pike? Well, I think as we decriminalize more in the broader kind of drug world for the drug war, steroids will be the beneficiary of that to some extent, in terms of sort of reduced punishments, perhaps, as there's a reconsideration of whether the war on drugs really worked or actually caused more problems than it solved. There's a movement to decriminalize testosterone specifically, for not for anything having to do with men using testosterone for testosterone replacement, and not for bodybuilders or others who might be using it to change the way they look, but by members of the transgender community, because people who are born as female and are seeking to transition to male, or somewhere on a spectrum of more masculine appearance, are desirous of using testosterone to make that transition. And what they're finding is that the controlled substance status, the DEA regulations that surround Schedule 3 status that steroids fall in and testosterone, is unfair, and it has a chilling effect and makes it more onerous for them to be able to access those drugs. And when you look and compare to the person who, on the other hand, is born male and is seeking to transition along the spectrum to a more female presentation or to become a female, well, the estrogenic compounds that are the hormones that are used for that transition are not controlled substances. And there's no DEA involvement, and there's no DEA red tape or regulations that apply. And so the idea that this is discriminatory to people who are born female versus those who are born male, who are seeking essentially the same thing, just to go in the other direction. And so 2 U.S. senators last year, I think it was, or the year before, wrote a letter to the Biden administration asking that the status of testosterone as a controlled substance be removed, or that at least it be lowered to a lower schedule from Schedule 3 because of this effect that it has on the transgender community. And so I write a lot. I was writing for Muscular Development for many years. That just ended recently when the magazine finally, print's been dying for a long time, Larry, and so finally a sad day that Muscular Development was like the last of the hardcore bodybuilding magazines to really disappear from the market. But I've been doing a lot of writing, and I continue to write, and I post on my Instagram a lot of information about everything that we've talked about. Rick Collins, ESQ, if anybody wants to follow me on IG. If you're interested in anything we've talked about, this is sort of my wheelhouse. But a lot of bodybuilders, when I started writing about this change, this 2 U.S. senators looking to decriminalize or remove the controlled substance status of testosterone, were like, yeah, finally, thinking that this might be a glimmer of hope for those who are using steroids non-medically for appearance purposes. I don't know if that's true. Certainly, the impetus for this is the transgender community, and if in fact there were to be changes in scheduling, I don't know whether it would be crafted in a way to not apply to the steroid using community for appearance. But it is interesting to see that, and it's also interesting to watch how sort of TRT is growing in this country, and there are many, many more men who are beginning to recognize, maybe not in their 20s, maybe in their late 30s or 40s or 50s, who are beginning to realize that what nature has in store for us is good for our species, but not necessarily good for us as individuals, right? I mean, once we're past breeding age, nature really doesn't need us anymore, right? I mean, the whole purpose of being here from nature's perspective is from the evolutionary drive to pass forward our genes. We have children, we raise those children until they're self-sufficient, and then we're kind of in the way, right? We're just using up scarce resources, and as far as nature's concerned, we might as well get out as soon as possible, and that's why nature's okay with us losing our hair and losing our teeth and getting wrinkled and old, and our bones losing calcium, and our muscles getting soft and atrophied. That's kind of makes it easier to sort of push us into the grave where nature really wants us once we're past there. And sure, I guess from a species standpoint, scarce resources, nature's looking out for the species. But from an individual standpoint, I don't think anyone really wants that to happen to themselves. And so when I hear people say, well, there's benefits to it's against nature, or it's not natural, and nature doesn't like something, well, nature's not your friend at a certain age. Nature is out to get you. Nature wants you out of the way. And so if there are techniques or methodologies or technologies that will allow you to extend your health span and be more vibrant and to slow down that aging process, whatever those technologies may be. And certainly many believe that testosterone is one of those for men whose testosterone levels decline over time. And there's science that shows after about the age of 30, you begin a very maybe slow 1% diminution of your total testosterone levels. So maybe it's not such a terrible thing to fool Mother Nature at a certain age.
I think it's important also to differentiate that there is a vast difference between a heroin addict or a meth addict and the person using anabolics. You know, the heroin addict, meth addict, they're not concerned about their health at all.
Right.
The person, most people using anabolics, people that I know, they're not smoking, they're not drinking alcohol, they're eating a clean diet, they're taking their vitamins, they're doing their cardio, they're lifting weights, they're doing all the things they can. And
all the things that the average American is not doing.
right.
Well, all of the, ironically, depending on the dose, certainly, and the specifics of the use, steroids have risks for sure, and at some point, maybe it becomes a quest for size or conditioning that puts you more at risk than you should be. But you're right, all of these other factors count in the opposite direction. You know, the typical steroid user is eating better than the typical American. The typical steroid user is exercising more than the typical American. You know, is doing more cardio, is doing more resistance training, is doing all of the things, taking more supplements, doing all things that enhance health. To what extent these balance out, could be the subject of a debate by those who would, take one side or the other. But the fact that that's not really considered in this conversation is a disservice.
Well, what should be considered is these same people, if given the option, if they could go to a doctor who didn't look down upon them and didn't talk down to them and get their blood work done regularly and all the other medical tests, I've had everything done, they would do it because people are concerned about their health. It's totally the opposite end of the spectrum from the heroin addict, meth addict, drug user that smokes cigarettes, eats crap, or doesn't eat at all, lives in the street. You can't compare it.
The patterns of use are different. The motivations for use are different. I mean, obviously, steroids are really the only drug that is in the Controlled Substances Act that is used for a non psychogenic effect. There's no psychoactive aspect to steroid users' use of steroids that they're intending to have. They're not using it to be stimulated or to see colors or to have a high or to zone out or to fall asleep or any of the other things that people might use these other drugs, hallucinogens, stimulants, depressants, etc. for. They're using it for a physical improvement of their physicality, which is unlike any other drug in the Controlled Substances Act. Testosterone and steroids are also hormones, unlike anything else in the Controlled Substances Act. And that brings us back full circle to the beginning when we said the FDA, the AMA, the DEA, the National Institute on Drug Abuse all said, hey, this is an apple in an orange cart. It doesn't belong here. It shouldn't be a controlled substance in the first place. And Congress just said, no, we want to get steroids out of sports, and so this is what we're going to do.
And it's also important to recognize that, your typical steroid user is working a career job, or at least a 9-to-5 job, and they're not knocking over the liquor store to get their bottle of testosterone.
Right. And that's a famous quote from a former district attorney of San Diego who said that nobody ever knocked over a liquor store for anabolic steroids, and you're right. And if you read that piece that we did in the Journal of the International Society of Sports Nutrition, you'll see that in our population that we surveyed, the average steroid user is better educated than the average American and is making more money than the average American. So you've got the average user was someone in their 30s with a white-collar job. I mean, not at all the sort of person that you think of when you think about the abuse of controlled substances.
Right. But we still have the question that's totally unanswered is where do we go from here? I know they've legalized marijuana, and I have my own ideas about why they did that. I actually believe they did that because it dumbs people down.
Well, I don't know what the solution is either, but I think it starts with education. I think it starts with putting aside narratives and beliefs that are contrary to the reality. It means that doctors need to become more educated. They need to cast off some of their old beliefs that are not supported. I think many doctors still think steroids cause testosterone cause prostate cancer. It doesn't. So, and there's now some evidence that it may help. So, bottom line is, I think educating doctors, educating the public to begin the removal of stigma is important. And then, little by little, I think as we reconsider the drug war, which, look, I represent a lot of people who are accused of steroid crimes, right? And most of my clients are people with no prior criminal history, who are decent, law-abiding people. Many of them are married, have families. Many of them are using steroids for personal reasons, for cosmetic or aesthetic reasons. The ones who are dealing steroids very often are people who are using them and started out by making it for themselves because they wanted to know what they were putting in their bodies, and so they started importing raw materials and then decided, hey, I can monetize this and I can make some money out of this, and it grows from there, right? So, but they're people who are committing no other crimes, who've typically never committed any other crimes, and wind up being on the receiving end of a federal charge, often a federal indictment, that will derail their lives forever. And there's no, unlike many state courts and state laws, which allow for after a period of time you can get your record sealed or get it in some way purged or expunged. That doesn't exist in federal court. You get a federal felony conviction, it rides with you to the grave. And it can impact your ability to get a loan, to get a job, to own a home, to go to school and get certain educational grants. Sometimes the cure is worse than the disease, right? So especially for somebody who's just using steroids. So I do think that we really do need to reevaluate the way we approach these things. There's better ways. A prohibition style approach to anything doesn't work. We should have learned that in the 1920s, right? When we created a prohibition style approach to alcohol. Certainly alcoholism is a problem. Nobody wants alcoholics to lose their jobs or ruin their families. And alcohol has its own dangers and risks, and some of the recent research on it is problematic for sure. But when we tried prohibition, it actually made things worse, right? Instead of harm reduction, it was harm escalation. We had bathtub gin, we had Al Capone, organized crime moved in. There were a million problems, and we ultimately had to reverse course, right? And so when we criminalized steroids and essentially created a prohibition style approach by removing doctors and pharmaceutical companies and pharmacies from the equation, we really did do to testosterone and steroids what we did to alcohol. And all of the things that we've talked about in this podcast were the negative effects of having done that, the harm escalation effects of having done that. So, I think the solution ultimately is that these are drugs that have serious effects on the body, good ones and bad ones, and drugs should be in the hands of physicians, not goofy physicians who are dealing with science from 30 years ago, but knowledgeable physicians who can appropriately prescribe drugs to patients in reasonable, safe, relatively safe doses with close supervision and monitoring that make sure that any sort of side effects are identified in a timely way. That's the solution to me. And I've always said that steroids should be in the hands of physicians, not in the hands of dealers. I represent people who get caught up in the switches because there is no other source of supply for the people who want them, and there are many people who believe that the law isn't appropriate. And you and I both know that there are countries where steroids are much more accessible to people. Steroids are not controlled. They're not looked at in the same way that they are here. They're not in the same law with heroin and cocaine. That's just something we did in this country. Other countries don't have it. Personal possession of a small amount of anabolic steroids in Canada, you're not getting arrested. Same thing in the UK, you're not getting arrested. But here, in some states in the United States, the personal use possession of even a single tablet of D-ball is a felony. So, we overshot the mark in this country in some ways. I hope at some point we reevaluate that, and with education and perhaps more podcasts like this where people can talk about these truths. And we're not condoning any illegal conduct. And I'm not, I always say I'm not pro-steroid, I'm not anti-steroid, I'm pro-truth, right? Let's get the truth out there. And I'm certainly pro-liberty. I'm certainly in favor of people who are adults, mature adults, making their own bodily decisions about what to do with their bodies, even if those decisions are not the best decisions. You and I have talked about this before. I'm a licensed skydiver. I've done skydives. I've jumped out of a plane at 13,500 feet, hoping to land and survive, right? And the reality is the risks are low and the risks have been overstated. But, there's 30 or so fatalities a year worldwide, and bad things can happen. People can say to me, Rick, what are you, out of your mind? What are you doing? Why would you jump out of a perfectly good airplane? That's a bad choice. You're stupid to do. Okay, you can say that. But I'm not arrested for doing it. The law allows me to make a choice, which I want. It's my body, and I should be allowed to make that choice, and the law allows it. The law would allow somebody to smoke cigarettes. That I wouldn't do. But certainly people are allowed to do it. To me, I look at that and say, that's crazy. Why would you do that? Why would you breathe that nicotine into your lungs and risk lung cancer? But I'm in favor of people. Look, if you want to do it, it's your body, and you should be allowed to do it as long as ultimately I'm not paying the cost of your medical treatment for it.
Right.
But why are we allowing all these other things? I don't eat, as I'm sure you do. We're not going to fast food restaurants every day. We're not eating, huge amounts of terrible carbohydrate and fat-laden foods and overeating like some people are until they get type 2 diabetes and need to have their toes cut off. We're not doing that. But nobody's being arrested for doing that. We don't arrest people for making any of these terrible, bad choices, arguably, that some people may say are. So, but we do that with steroids. We do that for the possession of any amount of an anabolic steroid without a prescription. And I'm not sure that it's not time to rethink that.
When I, after my federal case, I got on a federal probation, and I went right back to running my gym.
Right.
And one day I went to check in with my probation officer, and he said to me, we don't even know what to do with you. We've never had somebody like you. You know, you're not our typical person. You know, you don't
I
do
hear
anything.
that all the time, you know, and sometimes, you know, depending on the jurisdiction, sometimes I can find ways, and I try to work magic for every client. I do my best to do that. And in some situations, I can divert the case into a situation where the client can go to drug treatment court and ultimately maybe get the case thrown out or get a misdemeanor or some lenient treatment on it. And the client will go to the drug treatment program, be sitting in a group with a bunch of people who are addicted to heroin and cocaine and methamphetamine, and here's this like ripped, jacked up guy with a six-pack sitting there, and they're like, what do we do with you? You know, this doesn't make any sense. And, you know, it makes sense for me because I get the result that I want for the client, but, you know, I have to prepare the client that they're not going to know what to do.
I was in one of those at one point. As I was going through trial, they had me do it, and I remember everybody going around talking about their crazy drug problems, and they got to me, and I'm like, I don't even know what to say.
Right.
I don't do any of this stuff.
Right. Yep. Yeah. Before you know it, they're asking you for health advice, right? I mean, I've had clients who've gone to federal prison for, you know, Dave Palumbo, one a few years ago, he did a short 5-month stint there. As soon as he got there, he was writing out diet plans for all of the, you know, correction staff, all of the, as well as all the other inmates, and he was, you know, the in better shape than anybody there at the time. And I remember him telling me when it was time for him to go, he was only there a couple of months, everybody was like, where are you going? You know, well, look, I'm in the middle of my training program. You know, I'm only halfway through the diet you wrote. You got to stay a little longer. He was like, you know, okay, you know, but yeah, it's, you know, the steroid user doesn't fit into the typical box of people in the criminal justice system for drugs. Just doesn't. It's a completely different thing, and that's just another reason why I think Congress didn't think it through when they did what they did.
Well, hopefully, you know, there's changes, because the way things are going now, I think it's just gotten worse.
So lately, I've been dealing with a lot of SARMs cases, and that's a whole nother topic for another day, but I'm sure your viewers are familiar with selective androgen receptor modulators. So we talk about androgens. So these are selective receptor stimulants, essentially. The design of them is to affect the skeletal muscle without making your prostate the size of a watermelon, right? And so those are now kind of being targeted by some of they're not a controlled substance, although there was a law that Congress tried to, a bill that Congress tried to make controlled substances out of them that never passed. So they're not controlled, but the FDA is trying to crack down on them, and I've got a number of cases involving them. And you could actually attribute this in a way back to the Steroid Control Act, because the reason some of these are prevalent is that they're not controlled. And so, you know, in the same way that pro-hormones were kind of a way of getting around the prohibition of anabolic steroids, SARMs are like kind of the next generation of pro-hormones, where they're out on the market. And when we talk about the risks, I mean, some of them are being studied as drugs. Ostarine is going, you know, through some of the trials, et cetera. But some of them, there's virtually no clinical data in terms of safety for them. And so it's just, you know, who knows, right? It's human guinea pigs.
Well, we've covered a lot of information today, and I think a lot of people are going to have a lot of questions. I anticipate a lot of questions in the comments, and I think we should probably come back and do a another video, basically addressing those questions. So I know I'm 100% sure people are going to have a ton of questions about this, you know. And
well, you know, hopefully they've enjoyed it. I love talking about this stuff, Larry. I could talk about this stuff for, you know, 5 days straight. But, you know, we could, you know, have a little steak in between and then go back to it. But but yeah, I have a lot to say. I've had a lot of experience in dealing with these sorts of cases. I try to give information about testosterone and steroids and law, as well as other issues. I wrote a book a few years ago called The Alpha Male Challenge, which was a men's fitness book, and sort of I straddle that world of the world of physical fitness and the world of law, and I think that kind of unique intersection is really what I write about and am interested in. And I wrote a men's fitness book called Alpha Male Challenge, which basically was a self-improvement book for diet, exercise, and attitude for men of a certain age or becoming of a certain age. And so I do write a lot about kind of issues of masculinity and muscularity, both testosterone from a literal standpoint, chemical standpoint, and from a cultural standpoint, mm-hmm. because we are in a situation, as I've written often, where testosterone and masculinity are kind of looked down upon in society in a way that I think is sort of demonizing the traditional masculine archetype. But I try to write about this. Right now, a lot of my stuff is on Instagram. You can follow me there, and I invite all the viewers to do that. And certainly, if anybody has questions about the law, I do have a website at steroidlaw.com, so they can follow me there. My main legal site for my services as a federal criminal defense lawyer is at rickcollins.com. So I'm easy to find. You just Google me and you can find my number. My phone number is actually at the top of my Instagram page. And if anybody has a problem or needs help, I'm always here to try to help out anybody that I can. And I really appreciate your chatting with me. I love seeing you whenever I see you at the Arnold or the Olympia. We always have a good chat wherever we meet. And so I'd be happy to come on the show again and address any questions that people have.
And one thing I have to say, when I had my federal case, my jurisdiction was in Northern California. So I was required to hire 2 attorneys. And I heard from myself and my wife, the 2 best attorneys in that jurisdiction. Best reputation, highest paid. I got the 2 number 1 attorneys up there. And Rick supervised those 2 attorneys. And my attorney, Paul Meltzer, at the beginning, he was like, I'm the big shot attorney. I don't need any help. I know what I'm doing. At the end of the case, he said, that Rick Collins guy, he really helped. Because he knows his stuff. So, that says a lot.
Awesome. Thank you for saying that, Larry. And I hope to do this again soon. Happy New Year. And hopefully we'll run into each other again at either the Arnold or the next Olympia as well.
And one of the reasons I started this channel, the main reason, I saw so much BS on the internet, just put out there that's just not real. Right. And I wanted to be able to put the truth out so people would know what really is real and be able to differentiate between the smoke and mirrors and what actually is really happening. And like I said, I know people are going to have questions, and I think we should do a Q&A video sometime in the future. Then leave your questions in the comments, and we'll come back and address them.
Sounds good. Thanks, brother. Good seeing you. Good chatting with you.
All right, Larry Pollock from Underground Performance Gym. Don't forget to check out our website. Right now we have a sale on all of our merchandise and 0 enrollment in the gym. So go to www.undergroundperformancegym.com and don't forget to subscribe, like the video, and share it with your friends. This is Larry Pollock from Underground Performance Gym. Don't forget to check out our website, undergroundperformancegym.com. We have merchandise on sale right now. Also, 0 enrollment on the memberships. And don't forget to like and subscribe. Share with your friends, and make sure you leave comments, and so we can reply back.